ये साउंड कम किया है ना,
खत्म है, काट दिया।
लेकिन ये स्लीप मोड में चला जाता है। Hi and hello everyone, good afternoon, and hope the audio video is fine. Just kindly check and put a message. Yes, Yogesh, good afternoon, and we'll be doing the pharmacology MCQs. This is very important, particularly for FMG aspirants, and we are coming with this plan of certain important questions for FMG exams. So Farhad, hello, nice to see you back here. And so we have chosen some important questions here and try to concentrate on the high yield points here. So we'll start with the first question. The question is, Mr. Swami, age 48 years, comes to OPD complaining of drooping of eyelids, difficulty while chewing food, weakness of upper and lower limbs that fluctuates in intensity over time. So patient is having muscle weakness and the physician wanted to confirm, and he confirmed the patient is having myasthenia gravis. The question is, what is the drug to diagnose the condition myasthenia gravis? Yes, can anybody tell me what is the drug used to diagnose myasthenia gravis? Yes, you are correct. The answer is edrophonium. Edrophonium is the drug used to diagnose myasthenia gravis, and the test is called as tensilon test. Right. The next question they will ask you in the exams is, what drugs are used to treat myasthenia gravis? Remember, two important drugs for myasthenia gravis are neostigmine and pyridostigmine. These two had been asked in your exams already. Neostigmine and pyridostigmine are also used to manage another condition, that is cobra bite. We know the antidote for cobra bite is anti-snake venom, but why do we add neostigmine, pyridostigmine? Is to improve the muscle weakness. Neostigmine, pyridostigmine is also used to reverse the neuromuscular blockade, particularly by D-tuberculin or the ends with curium or curonium drugs. Suppose we have given D-tuberculin or curonium drugs, there is muscle relaxation. How do I reverse it? By using neostigmine and pyridostigmine. Remember, all these 3 points have been tested in your FMG exams. Now I want to ask you a question. There is a drug physostigmine. Now tell me which poison it is a drug of choice. Physostigmine is a drug of choice for which poisoning? Deepu, Anurag, Yogesh, can you tell me which poisoning physostigmine is a drug of choice? It is atropine poisoning. The drug of choice is physostigmine. Now atropine is also called as belladonna poisoning or datura poisoning. So please keep these things in your mind, and these are repeatedly asked. Now the drug tacrine was used for Alzheimer disease, but nowadays we have better drugs. Tacrine is not used because of hepatotoxicity. The next question that arises in the mind is, what drugs are used in Alzheimer disease? Alzheimer disease, remember the mnemonic, the guard memory. So the guard memory. Now first question, what neurotransmitter is decreased in Alzheimer disease? The acetylcholine is reduced. Now what is G for? The galantamine, R for rivastigmine, M for memantine, and you tell me what is D for. I am waiting for your answers. What do you mean by D here? And that is the drug of choice for Alzheimer disease. What is the drug by the name D? Yes, what is the name, guys? The name is donepezil. The name is donepezil, that is the drug of choice for Alzheimer disease. Yes. Now we covered so much points in that MCQs. Let us move on to the same question. A person was given muscle relaxant that competitively blocks nicotine receptor. So I told you muscle relaxant, they block NM receptor. Which of the following is used to reverse the muscle relaxation? We have discussed that the drug used is either neostigmine or pyridostigmine can be used. Carbachol, succinylcholine, physostigmine. Physostigmine is one important drug. I told you it's a drug of choice for atropine poisoning. That is the only thing you have to keep in your mind in this question. Let us move on to the next question. An ophthalmologist wanted to dilate the pupil. Dilating the pupil is called mydriasis for short period to check the fundus of the eye. Which of the following is the shortest acting anticholinergic mydriatic? The shortest acting is tropicamide. Tropicamide is the shortest acting mydriatic, and remember it is the preferred cycloplegic in adults. In adult, if you want to produce cycloplegia and mydriasis, we prefer tropicamide. Now another is atropine. Atropine is a preferred cycloplegic in children, that is less than 5 years. So less than 5 years, both have been tested in your FMG exams. Which is the shortest acting? Tropicamide. Longest acting is atropine, and atropine is preferred in less than 5 years. Why, sir? Because atropine has stronger action, and in children the ciliary tone is very high, and atropine can overcome that ciliary tone and cause cycloplegia. So these two things have been tested plenty of times, so the answer is C here. Right? Very good. Now you tell me which glaucoma I should not use atropine. Which glaucoma I should not use atropine? Anybody? There are two glaucoma, open angle and closed angle. Which glaucoma atropine is contraindicated? It is not given in angle closure glaucoma. Angle closure glaucoma. Now moving on to the next question. A 38-year-old had a drug addiction and was given varenicline. In which drug addiction varenicline is used? I know there may be delay in the relay, but you should answer along with me. Varenicline is used for what addiction, guys? Yes, you are right. It is used for smoking cessation. To stop smoking, the drug what we use is varenicline, and B for bupropion. The name is bupropion, and what we do is replace the nicotine. So that is called nicotine replacement therapy. So for smoking we have three varieties: varenicline, bupropion, and replace the nicotine. These are the three treatment for smokers. But if they ask in the exam which is the most effective therapy for smoking cessation, is varenicline. Opioid dependence, we use the replacement. Either I use methadone or bupropion. No, not bupropion. Don't confuse with that. The name is, yes, you are right. What is the name used for the opioid dependence? It starts with bu. Yes, come on. Yes, come on. Yes, buprenorphine. Right, so methadone or buprenorphine can be used. And what is the drug used to stop relapse in opioid addicts? If they ask you how do you decrease relapse in opioid addicts, the name is naltrexone. The name is naltrexone. Now please keep this in the mind. These type of questions, addiction, de-addiction questions will come. Anurag, if both bupropion and varenicline is given, varenicline has the superiority, so it has maximum efficacy. Alcohol dependence, I can use a drug called disulfiram, and please understand disulfiram inhibits an enzyme called aldehyde dehydrogenase, and it is a aversion therapy. Now what is the drug used to decrease craving in alcohol? Can anybody tell me what drug is used to decrease craving in alcohol and starts with N? Anybody? Yes. The name is naltrexone, is used to decrease craving in alcoholics and also to decrease relapse in opioid addicts. Now please don't confuse this drug with naloxone. Naloxone is an IV drug, and where do I use naloxone? It's a drug of choice for opioid poisoning. Suppose a person has come with morphine poison, then the drug of choice will be IV naloxone. Naltrexone is an oral drug. Please keep this in mind. Okay, so don't have confusions with these addictions because they have asked these things. Now I want to ask you another question, guys. Which drug used in amoebiasis can cause disulfiram-like reaction? Which drug used in amoebiasis can cause disulfiram-like reaction? Tell me. I am not getting this thing. Yes, disulfiram-like reaction. The amoebic drug which can do that, the name is called metronidazole. So any drug ending with nidazole, they are for protozoal infection, amoebiasis. Particularly metronidazole group of drugs can cause disulfiram-like reaction. Very good, MDS. Very good. Now moving on to the next question. Penicillin was injected to a patient. Suddenly patient went to anaphylactic shock. In anaphylactic shock, the drug given is. Now this is a repeatedly asked question in your exam. We know penicillin can cause allergy, particularly type 1 hypersensitivity reaction, and the drug of choice is adrenaline, that is 0.5. So it is given in the dose of 0.3 to 0.5 milligram, 1 in 1000, and it is preferred to be given in IM, and the best muscle is vastus lateralis. So please never forget this, not only for your exam, for your practice also. Now this is 1 in 1000 adrenaline for anaphylactic shock, and they had asked a question. Histamine is the culprit for anaphylaxis, and the drug of choice is adrenaline. What is the antagonism between histamine and adrenaline called as? What is the antagonism between histamine and adrenaline called as? Anybody? There are different types of antagonism: chemical, physical, physiological, then competitive and non-competitive. What is this? That is your FMGE exam question, guys. It is nothing but the physiological antagonism. So since adrenaline is the physiological antagonist for histamine, we use adrenaline as the drug of choice. Right? Okay. Now again, one of the favorite for examiner is norepinephrine. Let us understand the importance of norepinephrine. Norepinephrine acts on alpha 1, alpha 2, beta 1, and it has minimal or no action on beta 2. Norepinephrine or noradrenaline, never miss this drug. It increases diastolic BP, it increases systolic BP, and by that it increases mean artery pressure. So remember, noradrenaline increases all the pressures. Now what happens when all the pressure, the blood pressure increases? The reflex mechanism kicks in and there is reflex bradycardia. So this is going to happen when we infuse noradrenaline. Since it increases all the pressures, so it is the drug of choice for any shock with hypotension problem. So any shock, example cardiogenic shock, neurogenic shock, septic shock with hypertension, the drug of choice is noradrenaline. But noradrenaline is not effective in which shock? Anaphylactic shock. The drug of choice for anaphylactic shock is adrenaline. Now whenever you think of atropine, think atropine in two important conditions. Heart condition it is used. One is bradycardia. Atropine is used to manage bradycardia and heart block. And heart block we use it. Okay sir, so in this MCQ we learnt many points from this MCQ. Please concentrate on this. Now the next question is, a 55-year-old male patient had diabetes also, asthma also. Which of the following beta blocker is contraindicated in this patient? Now beta blockers, we know they end with lol. Now if they block beta 1 and beta 2, we call them as non-selective beta blockers. Now what happens if you block beta 2? There is bronchoconstriction and there is vasoconstriction, and also patient will not have hypoglycemic awareness. So these non-selective beta blockers cannot be used in a patient of bronchial asthma, peripheral vascular disease, and patients with diabetes. I cannot use it. So if I want to use it, I can use the cardioselective beta blockers. Now what are cardioselective beta blockers? Remember a simple thing. Any beta blocker name starting from A to N, it's cardioselective. Any name from N to Z, the name is non-selective. So the N here is nebivolol, N here is nadolol. So please tell me, metoprolol, yes, you can give it, it is cardioselective, it will not block beta 2. Betoxolol is cardioselective, atenolol is cardioselective. So the answer becomes A, sotalol cannot be used. Reason, sotalol also blocks beta 2 and it will worsen the asthma, it will worsen the hypoglycemic awareness in the patients. So in simple understanding, remember any beta blocker starting from A to N is cardioselective, N to Z is non-selective. Okay, I hope you have got this point, guys. Okay, so the answer is D. Now I will ask you one more question, one arrhythmia question. Patient has come with PSVT. Can you tell me what is the drug of choice for PSVT? Tell me what is the drug of choice for PSVT in an asthma patient? So can you answer this? Yes. Now PSVT, the drug of choice is adenosine. But if the patient is having bronchial asthma, adenosine cannot be given because adenosine is a bronchoconstrictor. So what I can do is, I can use a CCB called verapamil or diltiazem. So these are used. Another important question you need to understand here is, if a patient is having atrial fibrillation, then the rate control can be done with beta blocker or the CCBs. Suppose the same patient is having atrial fibrillation and asthmatic, then we don't want to take the risk with beta blocker. So what we use is CCBs like verapamil or diltiazem. So all these have been tested in your exam, so please concentrate on this. Okay, sir. Now let us move on to the next question. What is the antihypertensive preferred in patient with BPH and hypertension? If the person is having BPH also, hypertension also, what is the drug preferred? The drug preferred is prazosin because it can take care of BPH and hypertension. Tamsulosin is used if the person is having BPH only. But tamsulosin has one common adverse effect. The problem is floppy iris syndrome. Now floppy iris syndrome is a complication during cataract surgery. Then phentolamine, it is used for two important reactions, cheese reaction and one more reaction is clonidine withdrawal reaction. Now clonidine withdrawal reaction means when somebody is taking clonidine for a very long period and suddenly stopped, there is a rebound hypertension, then we use phentolamine. Now what is cheese reaction? Suppose somebody is taking MAO inhibitors for depression and they eat cheese. Cheese contain tyramine. Tyramine will enter our circulation, increase the sympathetic system and BP rises. So that time also we use phentolamine. Phenoxybenzamine is used to manage a problem called pheochromocytoma. Now this is used before surgery, that is called pre-operatively. So this question also been asked in your FMG exam already. So pre-operatively, what drug will you give to manage pheochromocytoma, it is phenoxybenzamine. Please note down all the 4 what I am discussing, they come under alpha blockers. These are all alpha blockers. Yes, very good Deepu, Rani, Krishna Kumar, very good guys. Now the next important aspect is the drugs for glaucoma. The adverse effect shown in image is caused by, now what is that? Just have a close look, the eyelash here and here. That means the eyelash growth has increased. Now which glaucoma drugs can do that? Which glaucoma drugs can do that? It is the bimatoprost or latanoprost drug. Remember, another prostaglandin is latanoprost. Now they will ask you these questions repeatedly. Latanoprost and bimatoprost, they belong to PGF2 alpha drugs. Now first the mechanism is they increase uveoscleral outflow. That is one question. What is the mechanism? Second question is they are the drug of choice for open angle glaucoma. That is the second question they will ask you. The third question they will ask you is what is the adverse effect we expect from these drugs? The adverse effect can be remembered by the mnemonic MIG. What is MIG for? M stands for macular edema. Macular edema. And I means iris pigmentation. Iris pigmentation. So the iris will become differently colored. It is also called as heterochromia iridis. And G for it causes growth of eyelash, what you see in the image here. So please note down the importance of prostaglandin. All these are very, very important. But one important point is these prostaglandins should not be used if there is inflammation in the eye. Why, sir? Because prostaglandins are inflammatory mediators. That's why. The next question, we will move to the next question. A boy is planning to travel by bus. Which of the following can be used to prevent motion sickness in this person? So when you travel by bus, train, flight, or by a ship, there is a chance of nausea and vomiting. So the drug of choice for motion sickness is hyoscine. So the answer is A, hyoscine. Suppose hyoscine is not given, then the next chance you can take is promethazine. So these two drugs are commonly used to manage the motion sickness. Yes, Anurag, UA, it is correct. Now the combination of doxylamine and pyridoxine, where do I use it? Doxylamine plus pyridoxine is the drug of choice for a sickness is pregnant woman, and that is called morning sickness. So it is used in morning sickness. So we know motion sickness, morning sickness. Now can you also tell me what is the drug of choice for acute mountain sickness? Acute mountain sickness, it has another name, high altitude sickness. Suppose you go to Leh, Ladakh, then what drug should be taken prophylactically? Yes, guys, you should answer that. Cetirizine and fexofenadine, they belong to second generation antihistamines. Antihistamines, and they don't produce sedation and they don't have anticholinergic property. Yes, tell me, what is the drug of choice for acute mountain sickness? Very good, Rani. The prophylaxis and treatment for that is acetazolamide. So remember the name. अगर आप ascend करने चाहते हैं acetazolamide, ascend करने के बाद jolly करना चाहते हैं, then take acetazolamide before going to high altitude. Suppose the person went to high altitude, suddenly developed breathlessness. Then what will you do? When they develop, bring the patient down, give him oxygen, then also you can give acetazolamide. So please remember three sickness, motion sickness, morning sickness, and acute mountain sickness, they are different. Now coming to the next one, migraine. Migraine is one of the topics which are commonly asked in the exams. 33-year-old female had recurrent episodes of migraine headache. She needs a drug to prevent these recurrences. So, in migraine we have two types of drugs. One is during attack and one is for prophylaxis. Now, they are asking which is used for prophylaxis. Now, tell me which is used for prophylaxis. Remember, the most commonly used drug for prophylaxis is propranolol. So, that is the answer. Now, triptans are the drug of choice for acute attack of migraine. Acute attack of migraine, the drug of choice are triptans. And what is the mechanism, sir? They are 5-HT, 1B, 1D, agonist or antagonist? Agonist. So, that is one thing. Another drug which can be used for acute attack of migraine is NSAIDs like indomethacin. Other drugs which are used for attack are ergots, the ergotamine, dihydroergotamine. But one drawback of ergot is they can cause vasoconstriction and gangrene. So, that question appeared in your FMGE exam. If somebody had taken ergot and they had vasoconstriction, how will you manage it? Obviously, when there is vasoconstriction, give a vasodilator, and the vasodilator what we use is sodium nitroprusside. Sir, why sodium nitroprusside is preferred? Simple reason, nitroprusside can dilate both vein and artery equally, and it is an IV drug, short acting. Right. Apart from that, the attacks can be treated with CGRP blockers. What is CGRP? Calcitonin gene related peptide, and they end with G-PANT. So, the drugs ending with G-PANT, it can be ubrogepant, rimegepant, they are for acute attack of migraine. So, these are very, very commonly asked. Now, there is another drug called erenumab. Erenumab, any MABs in migraine, they are for prophylaxis. It is also CGRP antagonist. So, this is for prophylaxis. So, these are the updates of migraine, keep in the mind. So, let me repeat again. Attack of migraine, we use triptans. Prophylaxis, most common drug is propranolol. There are CGRP blockers, two types. If they are MAB, prophylaxis. If they end with G-PANT, they are for attack of migraine. I hope I have covered plenty of this in this question only. Yes, Anurag, I will try to give that, don't worry. Then moving on to the next question. A patient came with pain in first metatarsophalangeal joint and high uric acid levels. So, as soon as you read the question, you know it is a case of gout. He was diagnosed with acute gouty arthritis. Which of the following is not used for treatment of gout? Now, please understand, gout is a small topic, but every year the question keeps on coming. So, they are asking what is not used in the treatment of acute gout. Remember, we use NSAIDs. Indomethacin is used, and remember, NSAIDs are drug of choice for acute gout. But can you tell me, one NSAID is contraindicated in gout? Which NSAID is contraindicated in gout? You have to tell me. Question mark for you. Yes, tell me. Which NSAID is not used in acute gout? Now, allopurinol inhibits xanthine oxidase, and one more brother of it is febuxostat. So, febuxostat and allopurinol inhibit the enzyme xanthine oxidase, and remember, the allopurinol is the drug of choice for chronic gout. It is a drug of choice for chronic gout, and allopurinol is never used in acute gout at all. So, the answer is B. Prednisolone is used in acute gout, and colchicine, it inhibits neutrophil chemotaxis. Neutrophil chemotaxis, and that is also used in acute gout. Right. So, the answer is B. Allopurinol is not useful in acute gout. Now, another thing they will ask you is, in gout, what are uricosuric drugs? Sir, what do you mean by uricosuric drug? They increase the uric acid in the urine. At least remember two important drugs, probenecid. So, they ban the acid, uric acid, and the one less, it lessens increased uric acid, lessens increased uric acid, the name is lesinuride. So, these are uricosuric drugs, and remember the enzyme called pegloticase. So, it is a recombinant enzyme which is used in chronic gout, and there is one more enzyme, the name is called Ras-Buricase, and that is used in tumor lysis syndrome where there is hyperuricemia. Yes, very good guys, most of you are answering that, very good. Okay, so I have tried to cover plenty of things in this, and remember, even though topic of gout is very small, plenty of questions come from that. Moving on to the next one, which of the following diuretic acts by inhibiting sodium potassium 2 chloride symport? So, obviously that drug is furosemide, and furosemide comes under loop diuretics, and they can also ask you what is the site of action. It is thick ascending loop of Henle. What about other drugs, sir? Now thalidone, chlorthalidone, MDS aspirin, which NSAID is contraindicated? Very good. The aspirin is contraindicated in gout because aspirin itself increases uric acid levels. Very good. Then moving on to the other aspect, chlorthalidone or any thiazides, the mechanism is they inhibit sodium chloride symport, and the site of action is early part of DCT. So, in recent FMGE exam they had asked the mechanism of thiazides. Acetazolamide is a carbonic anhydrase inhibitor, it is going to act in PCT. Spironolactone is a aldosterone receptor antagonist, and the site of action is collecting duct. And one more thing is osmotic diuretic, the name is called mannitol. Now tell me, where is the site of action? It is mainly PCT more than loop of Henle. If both are given, go for PCT more than loop of Henle. So this slide will tell you what are the mechanism and what is the site of action in the nephron. Then we will move on to the next one. Which of the following diuretic is preferred in a patient with road traffic accident with head injury and raised intracranial pressure? Now furosemide is one of the diuretic preferred in edema called pulmonary edema. Now where you see pulmonary edema in left ventricular failure, the diuretic of choice is furosemide. So the answer is B, mannitol, because mannitol is the drug of choice for cerebral edema. Not only cerebral edema, even in glaucoma, an emergency in glaucoma called acute congestive glaucoma, the drug of choice is IV mannitol. But remember, mannitol should not be used. Mannitol should not be used if there is cerebral hemorrhage. Cerebral hemorrhage, we don't use it. Spironolactone is the drug of choice for an edema called cirrhotic edema. Cirrhotic edema. And acetazolamide, I told you, it's a drug of choice for acute mountain sickness. So these are the points you have to remember. Then moving on to the next one, which of the following antihypertensive is avoided in patients with high serum uric acid levels? So patient with hypertension comes to you and uric acid levels are very high, then we should not use thiazides. Why, sir? Thiazides increases uric acid, they increase glucose, they increase lipids. Not only that, they decrease all the ions, potassium, magnesium, sodium, then chloride, but it increases calcium. But another adverse effect of thiazide, especially they can cause ED. ED means erectile dysfunction. They can do that. Enalapril, remember ACE inhibitors, the two important thing they can ask you, prils means they are AC inhibitor. Two important adverse effect of them is, please remember, dry cough and angioedema. And these are teratogenic drugs, and they can increase potassium levels. So all of them have been tested in your exams. Prazosin is a alpha-1 selective blocker. Atenolol is a cardioselective beta blocker. So please keep this in your mind. The answer is A. Okay, so if you are finding the session useful, put a thumbs up, press the like button and subscribe to the channel. So please do that, guys, and put a thumbs up if you are finding this useful, guys. Okay. Right. Now let us move on to the next question. 58-year-old male patient was started on digoxin for chronic CHF as he started complaining dyspnea and weight gain. Now the question is, what is the mechanism of action of digoxin? The mechanism of action of digoxin in heart failure is to inhibit sodium potassium ATPase pump. That is a mechanism. Now we can also use digoxin in atrial fibrillation. The mechanism in atrial fibrillation of digoxin is AV blockade. Krishna Kumar, all AC inhibitors are prodrug. All are prodrugs. No, yes, all are prodrugs except to the CAP-LE. The captopril and lisinopril are active drugs. Remember Captain Lee, you know Bruce Lee, Jet Li, these are Captain Lee, and these are the only active drugs in AC inhibitors. Now the next one is phosphodiesterase 3 inhibitors. They end with ambrinone and milrinone. So these are used in heart failure, that is acute CHF. Now SGLT2 inhibitors, can you tell me how do they end with gliflozin? They end with gliflozin. But whenever we discuss this type of questions of CHF, there is a problem called chronic CHF. Now chronic CHF, the disease progresses, and if I don't stop it, patient may die, that is mortality. Now there are certain drugs which decrease mortality in chronic CHF. Now obviously when you decrease the mortality, the person will live longer, that is they increase longevity. And the mnemonic for that is subdrugs. Sir, what are subdrugs which are known to decrease the mortality? Yes, for a diuretic called spironolactone and SGLT2 inhibitors. So recently they are tested SGLT2 inhibitors, and I told you they end with gliflozin. A stands for ACE inhibitor, they end with pril. ARBs, they end with sartan, and R9, it is a combination of two drugs, valsartan plus sacubitril. What is sacubitril, sir? It's an epilysin inhibitor, and B for beta blockers. So these drugs are known to decrease mortality, particularly in Indian populations. Clear with this, guys? So the answer for this question is AAA. Now let us move on to the next one. What is the drug of choice for treatment of ventricular tachycardia due to digoxin? Now digoxin can cause toxicity, and the toxicity will be like arrhythmias. So what is the drug of choice for ventricular tachycardia? The name is lignocaine. The name is lignocaine. Suppose if they give you digoxin induced supraventricular tachycardia, then what is your answer? The answer becomes beta blockers. Now what is the antidote for digoxin toxicity? Anybody? What is the antidote for this? The antidote also start with dig. It is digibind, also called another name digifab. Such a fabulous drug, digibind or digifab. Right. So since we are seeing the arrhythmias, let us discuss the drug of choices. I told you PSVT and all those things. If there is no digoxin toxicity, only ventricular tachycardia, then the drug of choice will be amiodarone. So I am not talking about digoxin toxicity. If patient is presenting with only VT, then the drug of choice is amiodarone. If it is not there, then you can give lignocaine. Now there is a problem called torsades de pontis. Now what is the drug of choice for this? Anybody? Torsades de pontis, that is acute attack of long QT syndrome. What is the drug of choice? The drug of choice is magnesium sulfate. Torsades de pontis. Right? So these are the important aspect you should keep in your mind. Then moving on to the next question. 32-year-old pregnant lady, BP of 152/90, high BP, pregnant woman. Which of the following is the first choice antihypertensive in the pregnant woman? What should I give in this lady? So the first choice of drug in pregnant lady will be labetalol. Labetalol will be the first choice. Suppose the question changes. Hypertension, she is pregnant and she is also having asthma. Then which drugs will you give from this? Now remember, asthma I cannot use labetalol because labetalol is a non-selective beta blocker. If that case, I have two options. Either I can give nifedipine, sustained release, or I can give methyl dopa. Since here they have not mentioned asthma, so the first choice will be labetalol. The first choice will be labetalol, so the answer is going to be C. Now, what are teratogenic antihypertensives? Teratogenic antihypertensive, if they ask you, remember two important ones, the pril and sartans. The ACE inhibitors and ARBs are teratogenic drugs. They should be avoided in pregnant women. These are tested in your exams. Okay. Now let me move on to the next question. A 50-year-old man is treated for atrial arrhythmias. He develops hypothyroidism and pulmonary fibrosis after 2 years. Which of the antiarrhythmic is most likely to cause this? I think this is not there. So the question is, which antiarrhythmic is most likely to cause lung fibrosis and hypothyroidism? The answer is amiodarone. So amiodarone can cause lung fibrosis, thyroid dysfunction. It can cause both hypo and hyperthyroidism. But another special problem with amiodarone is it can cause blue man syndrome. The person may look bluish. Can you tell me what drug can cause gray baby syndrome? Yes, you tell me. What drug can cause red man syndrome? Come on. The gray baby is done by chloramphenicol. And red man is done by vancomycin. So sometimes they will ask you the colors. Now red discoloration of secretions. Red discoloration of secretion is done by an anti-TB drug. An anti-TB drug, the name is called rifampicin. Right? Then skin pigmentation is done by an anti-leprosy drug. Can you tell me an anti-leprosy drug which can cause skin color changes? This is left for you. I will be waiting for your answers. Yes. Now actinamide can cause drug-induced lupus. So we write it as drug-induced lupus. So the anti-leprotic drug which causes skin pigmentation is clofazimine. Clofazimine, sir, why it will cause? Because clofazimine is a dye. Where did we derive this clofazimine? Is from a dye. So dyes will color. So these are the different colors you should keep in your mind, right? So the answer for this question is A, amiodarone. And one more thing, remember, amiodarone can also cause the corneal deposits. It is called as cornea verticillata. Yes, many are telling dapsone is not going to cause that. An asthmatic patient present to the emergency department with PSVT, what drug will you give for this? You answer that. PSVT, asthma patient, what is the drug used for management, guys? Usually the drug of choice for PSVT is adenosine, but adenosine is a bronchoconstrictor. I cannot use it. So what is the alternative drug I can use is verapamil. So the answer for this question is verapamil. Now nifedipine is also a CCB, but this depends, they have no action on heart. But verapamil will act on the heart also, blood vessel also, but dipins, they act on blood vessel only. And digoxin is a cardiac glycoside. And guys, most of you are answering B for this, and that's why I told you patient is asthmatic. Now I want to tell you, importantly, please remember this. Whenever they give a lady, check whether they have given pregnancy in the question. Then you should be careful. And whenever they have given a case, check whether they have given asthma in the case. That means you should be careful in that. Okay. Next, moving on to the anti-epileptic drugs. Drug of choice for partial seizures. Now the drug of choice for partial seizure is carbamazepine. That is the best answer. If it is not there, you can use lamotrigine. Carbamazepine is also drug of choice for a neurological problem. Anybody? Valproate is drug of choice for so many conditions, GTCS, myoclonic seizures, right? Any seizures, it is a drug of choice. Even absent seizure, it is a drug of choice. But ethosuximide is the drug of choice for children with absent seizures. So many times student asks me this question, sir, for absent seizure, is it ethosuximide or valproate? Now in the question, if they have given a child, then go for ethosuximide. If they have not given, then go for valproate. Now the drug of choice, carbamazepine, it is used for a condition called trigeminal neuralgia. For that, it is the drug of choice. Now another epilepsy condition they can ask you is a condition called infantile spasm. Infantile spasm is also called as West syndrome, hips arrhythmia. Then what is the drug of choice? Anybody? Drug of choice for infantile spasm. If there is infantile spasm also and tuberous sclerosis, then the drug of choice is vigabatrin. But the drawback of vigabatrin is it can cause vision impairment. Another seizure they can ask you is febrile seizures. Febrile seizure, the drug of choice is nowadays midazolam. The name is midazolam. How do I give it? Through the nose, intranasal. Now if it is not given in the option, then you can give diazepam, and diazepam is given by rectal route. So rectal diazepam can be the option. So guys, infantile spasm, the drug of choice is ACTH. It is the ACTH which is given. The last two questions I will ask you in epilepsy are, what is the drug of choice for status epilepticus? So if the person keeps on convulsing repeatedly for more than 30 minutes, then the first drug what I do is lorazepam or diazepam can be started. And one more problem is eclampsia. So what is the drug of choice for eclampsia? It is the magnesium sulfate. So most of your questions are now clinical. That's why we have covered the various types of epilepsy and the drug of choices here. Okay, so put a message if you are clear with this, guys. Put a message. Put a thumbs up in between. Okay. Then moving on to the next thing. A patient was recently started on haloperidol. Sir, what is haloperidol? It's an antipsychotic. Is it a typical or atypical? It is a typical antipsychotic. Now what happened? Few weeks later, the patient developed tremors, rigidity and bradykinesia. What is the treatment for this? Now please understand, typical antipsychotics, they block dopamine in the brain. So what happens? There is increase in prolactin. They can increase the prolactin. Second important problem is they can cause extrapyramidal symptoms. Now this is frequently asked in your exam. What are the extrapyramidal symptoms of these drugs? They can produce a problem called acute dystonia. So the neck may turn to one side like this. The eyeballs can go up. Then what is the treatment for this? The treatment for this is either you can give benzexol, benztropine, or you can give promethazine. These are given and plenty of times this has been tested. Now I want to ask you, can you tell me one antiemetic which can do this acute dystonia? Can you tell me that? Which antiemetic can cause acute dystonia? The second problem patient may develop is Parkinson disease like symptoms. For that also the treatment will be same drugs. So here benzexol has one more name. The other name of benzexol is trihexyphenidyl. So that is the answer for this, B. The answer is B. So if you see the extrapyramidal symptoms, number 1 dystonia, number 2 Parkinson disease, number 3 patient may develop akathisia. So how do you manage akathisia? By using beta blocker propranolol, or you can use a drug called benztropine. Benztropine. Sometimes you can use benzodiazepines. Now one more problem that happens is neural malignant syndrome. And the ion responsible was asked once. It is the calcium ion. And what is the drug of choice for that? The drug of choice is dantrolene. It is called as dantrolene sodium. So all these have been tested in your exams repeatedly, particularly for typical antipsychotics. Okay, typical antipsychotics. Now let us move on to another disease. The disease name is Parkinson disease. Which of the following is a MAO-B inhibitor used in Parkinson disease? Remember, any drug ending with gelin, they are MAO-B inhibitors. So the answer is B. Yes, very good, Nidhi. The antiemetic which causes the dystonia is metoclopramide. So never miss this antiemetic. They will ask you this. So MAO-B inhibitor is selagelin. Any drug ending with capone is a COMT inhibitor. It's a COMT inhibitor. Amantadine, they will ask you two important adverse effects of this. What is that? It can cause ankle edema and livedo reticularis. But one specialty of amantadine is it can stop the dyskinesia. It has anti-dyskinetic property. Now pramipexole, ropinirole and rotigotin, all these are also used, but they are called as non-ergot D2 agonist. Now they are being used in a problem called restless leg syndrome. Apart from Parkinson disease, they are used in restless leg syndrome. This is again a question asked in exams. Now remember, nowadays gabapentin is the drug of choice for restless leg syndrome. If gabapentin is not given, then you can use any of these prami, ropi, roti. You can use any of this, that is prami, roti and ropi. Okay? Yes guys. Now let us move on to the next question. The next question is morphine. Morphine is used in following condition except. We know morphine is an opioid. Morphine is used in MI, left ventricular failure. Mainly it is used in cancer pain, right? It is used in cancer pains. It is used in MI, it is used in cancer pain, even post-operative pain, but it should never be used in biliary colic. So morphine is contraindicated in biliary colic, head injury, we should not use it, and it should not be used in one more condition, that is bronchial asthma, because in asthma it can release histamine and worsen the asthma. Now my question is, can I use pethidine in a patient with biliary colic? Answer yes or no. Tell me, there is one more drug, pethidine, it's an opioid, can I use it in morphine poisoning? Yes or no? Now remember, when we use morphine for cancer pain, the drug can develop tolerance. Now why it may develop tolerance? Because when you give morphine again and again, the receptors will develop desensitization. This question also been tested in your FMGE exam. So if I use morphine repeatedly, why it will develop tolerance? That is due to receptor desensitization. So pethidine can be used in biliary colic. Yes, you can use it. Very good guys. Why? Because pethidine has anticholinergic property, that means atropine like property, and atropine group of drugs can be used in biliary colic because they relieve the spasms. Yes, MDS aspirant Harry, Nidhi, Anurag, very good. All of them have given yes to this. Very good. Now moving on to the antidotes. Remember, antidotes is a part of so many exams. Now heparin, they are asking what is the antidote of fibrinolytic drug. Sir, what are fibrinolytic drugs? Example, can you give me? Altiplase, streptokinase. Now these are nothing but they cause lysis of the clot. So these are also called by a name thrombolytics. These are also called as thrombolytics. So what is the antidote for them? The antidote is ECA. What is ECA? Epsilon amino caproic acid. Another you can give is tranexamic acid. So these come under antifibrinolytics. Now let us analyze the antidote for other drugs. Heparin. Heparin and low molecular weight heparin, the antidote name is protamine sulfate. Yes, Deepu, you are right, the answer is B. Now altiplase, we don't give altiplase only for this. Now let me tell you other drugs and ask you the antidotes. Tell me the antidote for dabigatran. Tell me for apixaban. Tell me for warfarin. Tell me for this. Now dabigatran, dabi. So whenever dabi, remember the name I drink daru. So daru, whenever there is daru, daba daba ki pina. So I daru, Sizuman. Now 10th, 10A ban, it's a 10A inhibitors. Now remember apixaban, ande. So remember when you are in 10th standard you got ande, that is 0. So net you got in 10th standard, net in 10th standard you got ande 0. So the name is called andexanet. Warfarin, I think most of you know, it is vitamin K. Vitamin K. Now the next thing is, suppose I gave warfarin and patient had bleeding. He came to me with bleeding, then what should I give? Yes, I will give vitamin K, but it takes time to work. So the next step, if they ask you, then what should I do? I should give them 4-factor prothrombin complex. So this can be given. If it is not there, fresh frozen plasma is also given. So this is what the drugs you have to remember. Now another thing you have to remember in anticoagulant, remember the heparin. Heparin, what monitoring you have to do? It is the APTT monitoring. Now warfarin, what monitoring you have to do? That is left to you. Tell me what monitoring you want to do for warfarin. So I am searching for your answers. Sir, for warfarin, I do something called IRR, and that is called prothrombin time, and it should be between 2 to 3. Yes, you are right, MDS. It is PT and it is expressed in international normalized ratio. Please understand, rosuvastatin, they end with vastatin. Mechanism is what? The statins are HMG-CoA reductase inhibitors. So the answer is B. What is PPR gamma agonist? PPR gamma agonist, we have a diabetic drug called pioglitazone. But a drug used in dyslipidemia, which is a PPR alpha agonist, they are called as fibrates. Now please remember, fibrates are also used in dyslipidemia and they cause maximum decrease in triglycerides. And statins, they decrease maximum LDL among all the drugs. Maximum LDL is decreased. Now what drug inhibits intestinal absorption of cholesterol? The name is called ezetimibe. And bile acid binders, they are called resins, they all start with chole. Cholestiramine, cholestipol, cholesevelam, and these drugs are safe in pregnant women. Safe in pregnant women. And one complications you should remember about fibrate, they can cause gallstones. So this is being tested in your exam. They can cause gallstone as adverse effect. Remember, it is the adverse effect I am telling you. Okay, sir. Now what is the adverse effect of all the first 3 drugs, that is statins, fibrates and a vitamin called niacin? All the 3 can cause myopathy. So all the 3, they can cause myopathy, that means muscle pain. So that is rosuvastatin mechanism. And next we will move on to the vomiting cases. Drug of choice for late CANV, remember the neurokinin 1 antagonist, and they end with pitan. So the answer will be aprepitant. Now the drug of choice for early CNV, they end with cetron. They are 5-HT3 blocker. They are the drug of choice for early CINV. Sir, what is early? Within 24 hours. What is late? Between 1 to 5 days. And doxylamine with B6, they are used in a vomiting condition. What is that vomiting condition? Morning sickness. So this combination is used in morning sickness. And nabilone, anything having nabi in the name, it is a cannabinoid 1 agonist. Apart from vomiting, they increase the appetite. So where can I use them? I can use them in anorexia, particularly in HIV patients. Recently they had asked in FMG, what is the best combination for CINV? The best one is to give 5-HT3 blocker plus neurokinin 1 blocker plus steroid, that is dexamethasone. So this is the best combination for treating CINV. Now many a times what happens when we use anti-cancer drug, or we use anti-HIV drug, they can cause diarrhea. Now tell me, what drug will you use to treat this? Anybody? Suppose I am using anti-cancer drug, anti-HIV drug, and there is diarrhea in the patient. What drug should I use to treat the diarrhea? Come on. Yes, the name is loperamide. So it's an opioid which can be used for these diarrheas. Again, this is your FMG question only. Okay. Now following drugs are used in acute attack of asthma. Remember, acute attack of asthma, mainly we use bronchodilators. So we use salbutamol, and it is a SABA. Hydrocortisone, yes, we use IV. Why do we use hydrocortisone, which is a steroid? In attack of asthma, it has shown to increase beta 2 response. We still use it. Now what is not used is sodium chromoglycate. So the answer is C, sodium chromoglycate. Remember, chromoglycate is a mast cell stabilizer. And that is used for prophylaxis of asthma, not for attack. Sir, can you tell me one more stabilizer? Yes, I will tell you. The name is called nidochromil. Now terbutaline also belongs to SABA. So remember, salbutamol, hydrocortisone, terbutaline, all are used for attack of asthma. Even we use a drug called ipratropium in attack of asthma. Now tell me what is the mechanism. I am waiting for that. What is ipratropium mechanism? It is a SAMA drug, short acting muscarinic antagonist. One more drug is LAMA. The name is tiotropium. Then they ask you the drug called montelukast. What is the mechanism of montelukast? It's a leukotriene receptor antagonist. So this is a commonly asked question, and please remember, montelukast is also for prophylaxis. Now we have a drug which can inhibit LOX, and the name is called xylotone. Now I will ask you last question in asthma. Can you tell me a monoclonal antibody which blocks IgE? Can you tell me the IgE blocker here? Yes, come on guys. Can you tell me the IgE blocker used here? The IgE blocker name is omalizumab. Omalizumab. If you have a confusion, remember IgE, omali, like that. So you will not get the confusion here. Okay? Okay. Then let us move on to the next concept. It is OMA. Yes, Nidhi, you are right. MDS, you are right. Harry, yes. Now, intermediate acting insulin among the following. So, insulin preparations can be asked. Remember the insulin aspart. You remember the mnemonic as LAG or remember as GAL. The rapid acting insulins, remember them as GAL, that is glue. Just a minute, there is some problem here. Yeah, okay. So A for aspart, yes, then L for lispro and glulysin. So glulysin, aspart, lispro are rapid acting insulin. Regular insulin is short acting insulin. Glargine, remember glargine, then detemir and degludec. These are longest acting insulins. We call them as long acting insulins, also called as peakless insulins, also called as basal insulin. Among all the insulins, the longest acting is degludec. You read the name degludec, it works for 42 hours. And the answer is D, NPH insulin is the intermediate acting insulin. NPH insulin is the intermediate acting insulin. Now the question is, all the insulins are usually given by just a minute. Okay. Just a minute, guys. Now let me ask you this question. Most of the insulins are given by subcutaneous route, but there is one insulin which can be given IV also. What is the IV insulin given? In emergencies like diabetic ketoacidosis, managing hyperkalemia and hyperosmolar non-ketotic coma, which insulin preparation is used? Yes, anybody? The insulin preparation is the regular insulin. So this is also a question in FMG they had asked. You can give it IV also, subcutaneous also. Otherwise, almost all the insulins are given by subcutaneous. Now tell me any insulin which is given by inhaled route or any inhaled insulin we have. Is there anything like that? Yes, we have an insulin called Afrezza. The name of the insulin is Afrezza insulin. And a common complication of insulin is they decrease glucose, that is hypoglycemia. They decrease potassium, hypokalemia. And they can also cause weight gain. Remember, these are the important problems with insulins. Then moving on to the next aspect. Which of the following drug decreases hepatic glucose output? The answer is B, metformin. Metformin inhibits a step called gluconeogenesis, and thereby it reduces hepatic glucose output. Now pioglitazone, I have told you, it's a PPR alpha or gamma. It's a gamma agonist. And please remember these two drugs, pioglitazone and metformin, they also are called as insulin sensitizers. And metformin, one important thing to remember is it is also used for PCOD. And one of the common adverse effect of metformin is GAT upset. Recently they had asked which diabetic drug can cause severe diarrhea. Metformin. GAT upset is very common. But the dreaded complication of metformin is it can cause lactic acidosis. So that's why in renal failure you should be very careful when you give metformin. Whenever you think of pioglitazone increase a risk of one cancer. Tell me which cancer risk is increased. I am waiting for that. Now glimepiride, anything starting with gli, glimepiride, gliclazide, whatever, they are sulfonylureas and they act by inhibiting ATP sensitive potassium channel. Then acarbose, any drug having bose, they are alpha glucosidase inhibitors. Yes, these are very, very important. They are testing this again and again. Anurag Kumar, tell me what cancer risk with pioglitazone? Pioglitazone, the risk of bladder cancer is seen. Yes, Nidhi, you are right. You are right. And also, which diabetic drug increase the risk of medullary carcinoma of thyroid? Medullary carcinoma of thyroid risk is increased by the GLP-1 agonist. Now these are all the updates. Please keep them into the account. Right, sir. What is the next question, sir? Which of the following is a GLP-1 receptor agonist? GLP-1 stands for glucagon-like peptide 1. Now GLP-1 agonist, they end with like this. Either they end with glutide or they end with nartide. So search for a drug like that. Repaglinide, no, it is a meglitinide. Its mechanism is similar to sulfonylureas. Any drug ending with gliflozin, they are SGLT2 inhibitors. Pramlinitide, remember the name as amylin, amylin. So it's a amylin agonist. It stimulates the amylin. And I told you any drug ending with lutide or glutide or nartide, they are GLP-1 agonist. Now here the purpose of question, we got the right answer, but the purpose is to tell you some specialties of empagliflozin or any SGLT2 inhibitors. Remember, they inhibit sodium glucose transporter 2, so there is increased urine glucose, that is called as glucoseuria. So they can cause glucoseuria. This question appeared in your FMGE exam. Glucoseuria. Now obviously when glucose is coming too much in the urine, the bacteria will enjoy, so patient may develop UTI. Not only bacteria, the fungus will also enjoy, so there will be fungal infections, that is in the genital area. And they have shown very rarely this problem, diabetic ketoacidosis, then limb amputations, fractures and Fournier's gangrene. If you don't want, at least remember they cause UTI, fungal infection and glucoseuria. Now certain drugs in diabetes, diabetic drugs are also used to manage obesity. Now obesity is a common problem, so the questions come from that. Now what are the GLP-1 agonists approved for managing obesity? Can you tell me? I will do one thing, I will tell one drug name, liraglutide. So any other drug you know which is GLP-1 and used for obesity. The other drug that is used is orlistat. Now this inhibits the enzyme lipase, and one adverse effect of this drug is steatorrhea. Steatorrhea, and this was your FMG question, steatorrhea. So which obesity drug causes steatorrhea? Orlistat. No exenatide, Nidhi. No, it is the semaglutide. Semaglutide. Please remember like that. If you want to become lean, liraglutide. if you want to become slim, semaglutide. So lean, liraglutide. Lean means becoming thin only, slim means same only, liraglutide, semaglutide. Now usually in pharma we tell any drug ending with tide is a peptide and they are not given oral. But semaglutide is an exception, you can give oral also, parenteral also, that is the specialties. Then moving on to the next one, pegvisomant. Pegvisomant is used to manage what problem? Now remember it is soma, that is growth antagonist. So where do you use growth antagonist? It is used in acromegaly. Now are there any drug for acromegaly apart from this? Yes, we have the D2 agonist and the name is B and C. What is B, sir? B for bromocriptine, C for cabergoline. Now please remember at least the name cabergoline. Now cabergoline is also used whenever there is prolactinoma, hyperprolactinemia, galacturia. Wherever the prolactin is high, the commonly used drug is cabergoline. Another drug which is used in acromegaly is octreotide. It is a somatostatin analog. So this is commonly asked in the exams. Let us move on to the next question. Osteoporosis, a very common problem, osteoporosis. What is the monoclonal antibody against rank ligand used in osteoporosis? Yes, tell me, what is that? The name is denosumab. Even if you don't know anything, they have asked monoclonal antibody, that means anything ending with mab is the one. How do I remember this for the exam? Den, that means it increases the density of the bone. OS, it is used for osteoporosis. The name is denosumab. Now any drug ending with a dronate, they belong to bisphosphonates. Now please understand they are the drug of choice for osteoporosis. These are drug of choice for osteoporosis. Any osteoporosis, it may be senile, it may be due to drug induced, or it may be due to postmenopausal. For all, the drug of choice is dronates. But one risk factor with these drugs are, if you are using them for more than 5 years, they themselves can incur risk of fracture, particularly intertrochanteric fractures. Then the name is teriparatide. So in Hindi I can call it as teri pair mein tide ho gaya. So almost all the drugs what we have written, they inhibit the action of osteoclast. Whatever the option in all the 4, they inhibit osteoclast, but the drug which stimulate the osteoblast is teriparatide, and this is a bone forming agent, and that is also called as anabolic activity. But the problem with teriparatide, agar teripar बढ़ गया, then after some times this has a risk more than 2 years. It has a risk of a cancer called osteosarcoma. That's the reason teriparatide is not used for very long periods. Only it is used for severe osteoporosis. Hypertension with osteoporosis is thiazide. See, thiazides can supplement the patient, but it is not going to be the drug of choice. Hypertension with osteoporosis, still you have to give bisphosphonates only. Yogesh, very good question. Yes, you can use thiazide, but they are not the drug of choice. Hypertension with osteoporosis, to manage osteoporosis, you have to give bisphosphonates. And please understand, thiazides are useful in osteoporosis. Okay. Which of the following drug is used in breast carcinoma in premenopausal women? Now, ethinyl estradiol, that's an estrogen preparation. We will never give that in breast cancer. We know estrogen itself will cause breast cancer. Roloxifene is a serum which is used in postmenopausal osteoporosis, and it is also used to prevent breast cancer. Roloxifene is used to prevent breast CA. And the drug used to manage breast cancer is tamoxifen. It is a SERM. But one complication of tamoxifen is been tested. The complication is it can increase the risk of one cancer. What is that, guys? Tamoxifen can increase one cancer in a female. What is that? Clomiphene citrate, mainly it is used to manage anovulatory infertilities. But one complication of clomiphene citrate is it can cause ovarian hyperstimulation syndrome, and long-term usage can lead to ovarian cancers. Yes, tamoxifen has a risk of what cancer? The uterine cancer, endometrial cancer. Yes, very good, Anurag. Endometrial or uterine cancer risk. Harry Kaushik, sir, class कब तक है? Tell me, कब तक चाहिए? अभी खत्म करो या चलो? Tell me. Okay, so these are important, and remember the roloxifene, tamoxifen have one common adverse effect. What is that? They both can produce venous thromboembolism and hot flushes. But the advantage of roloxifene is it will not increase the uterine cancer risk, but tamoxifen will do that. Now the next drug is mifepristone. Mifepristone is used in below condition except. Now mifepristone can also be used in Cushing syndrome because mifepristone blocks the glucocorticoid receptor. Anurag, tamoxifen you can use it in postmenopausal women also, but here they are asking in premenopause. You can use it in premenopause also, postmenopause also. Mifepristone is used in the below condition except Cushing syndrome, yes we use it. Medical termination of pregnancy, yes we use. Postcoital pill, yes we use. Now it is not used in primary infertility. Now please understand, whenever we have medical termination of pregnancy, we use mifepristone and misoprostol. Mifepristone and misoprostol. Now what should I give first and then what should I give next? Now tell me, it's a question for you all. In MTP, these two drugs are used. So which one should be given first? Tell me. Now postcoital pill is also called as emergency contraceptive. Now commonly we use OCPs, then the mifepristone, then levonorgestrel. So these are given within 72 hours after the after the coitus. Recently we have come up with a drug called ulipristal given at the dose of 30 milligram. It can be used up to 120 hours, that is up to 5 days. Now if the lady comes after 5 days, then what is your advice? Tell me, guys. Yes, many are in confused state. Let me tell you, first to give is mifepristone and then I have to give misoprostol. There is a logic in that. Now mifepristone is a progesterone antagonist. First we stop the progesterone action on the pregnancy. Then I give misoprostol, it contracts the uterus and there is abortion. If I don't want the logic, I still want to remember mifepristone ends with 1. That means that is the first one to give. And then misoprostol. If you still have the confusion what to give in the first, remember mifepristone 1. It is only telling you give me the first one. Then misoprostol. Now after 5 days if the lady comes, the best one to give is IUCD. Again this is your FMG question. Okay guys, so if you are liking, put a like message, subscribe to the channel, and your messages means a lot for us. Yes, please put a message. How is the session going on? Yes, guys. Nidhi, usually Mifi 600 microgram and levonorgestrel 1.5 milligram that is used, and ulipristal is 30 milligram, and OCP's 2 tablets has to be taken at the gap of 2 hours. Okay, so thanks for that thumbs up. Now let us come to the certain general pharmacology. Choose the incorrect statement about drug absorption. First pass metabolism reduces viability. Yes, true. More the first pass, less is the viability. Now, which routes have first pass? Remember, there are only 2 routes which have first pass. Oral and rectal have first pass. Will sublingual has first pass? No, sublingual has no first pass metabolism. Now, which route has 100% viability? Anybody can answer this? The next option is highly ionized molecule are absorbed from the stomach. False. So, highly ionized means water soluble drugs will never get absorbed. Heparin is not absorbed due to its large size. True, that is why it is called unfractioned heparin. Food interferes with the drug absorption. True. So, the statement B is false. 100% viability is seen with intravenous route. Intravenous route. Which of the following antimicrobial should not be given to a chronic asthmatic patient managed on theophylline therapy? Now, theophylline is a methylxanthine. Now, if the dose of theophylline increases, it can cause 2 complications. Patient may develop seizure and arrhythmia. Now, if I give theophylline with the enzyme inhibitor, then the problem happens. So, the question is asking which is an enzyme inhibitor in the option. Can you tell me? Yogesh, inhalation also has no first pass. That is why I told you only 2 routes have first pass, oral and rectal. Uske alawa jo bhi hai, they do not have first pass. Yes, very good. The antibiotic which is enzyme inhibitor is erythromycin, and one more you can remember, ciprofloxacin. These are enzyme inhibitors. So, if I use these drugs along with that, the drug is not metabolized and there is a risk of overdose and toxicity. Yes, the answer is A, erythromycin. Cefotaxime, cotrimoxazole, amoxicillin have nothing to do with the enzyme inhibition. I think you will tell that. 32-year-old patient had anaphylactic shock, given adrenaline 1 in 1000 by IM route. The histamine are antagonized by adrenaline. What is this antagonism? Sir, okay, please, sir. I didn't get your question, Harry. Sir, why place सारे अस्तात वाले drug? So here the answer is the histamine and adrenaline, the antagonism is called as physiological antagonism. Then moving on to the next one, clinical trials. So most of the questions are on clinical trial. A patient was on clinical trial, drug X was evaluated for hypertension. It was used in human healthy volunteers. Drug caused severe gastritis. What phase of clinical trial is it? Now, when we use human healthy volunteers, what phase of clinical trial is it? Yes, obviously human healthy volunteers are involved in phase 1 trial. Please understand and to check maximum tolerated dose. Phase 2 is the first patient introduction. and here we check for efficacy, then we check for safety, then pharmacokinetic, and also we do something called dose ranging. And phase 3 we confirm efficacy. We confirm efficacy. Sir, how do I differentiate phase 2 and phase 3? Suppose you are doing in 1 or 2 centers, that is phase 2. If you are doing in multiple center, it is phase 3. And which phase there is maximum drug failure? Maximum drug failure occurs in phase 2. And phase 4 is also called as post marketing surveillance. Harry Kaushik, I have made a list. At the end of the this thing, I will give my Telegram group. You can put a message to me. I will communicate there. Okay, the table is there. I will give it to you. So these are the things. Phase 4 is also called as post marketing surveillance. So it is done after you obtain a marketing license. And phase 0 is also called as micro dosing trial. What is the aim of phase 0? Phase 0 is also called as microdosing. The aim is to check pharmacokinetics of the drug, right. So let me repeat again. The main aim of phase 1 is safety. Maximum tolerated dose is found out in phase 1. Dose ranging is done in phase 2. Maximum drug failure occurs in phase 2. The confirmation of efficacy is done in phase 3. Post marketing surveillance is also called as phase 4. Now coming to the next question, the antimicrobials. Which of the following acts by inhibiting cell wall synthesis? Now whenever you think of antimicrobials, they can target the cell wall, cell membrane, protein, DNA, and they can affect the metabolic pathway. Now remember, the cell wall synthesis is affected by cephalosporins, that is the right answer. Now we will do one thing, we will make a chart. Who will affect the cell wall? Who will affect the cell wall? Cell wall, remember the beta lactams and the vancomycin. Now what are the beta lactams here? Penicillin, cephalosporins, carbapenems, and monobactams. Then coming to cell membrane, we have 2 drugs, daptomycin and one more, the polymyxin, B and E. Polymyxin B, E is also called as colistin. Then the target of DNA, the DNA gyrase inhibitor, they are floxacin. They end with floxacin, for example ciprofloxacin, like that. Then the inhibitor of folic acid synthase, the name is sulfonamides, and they can also test a drug called dapsone. Now the another enzyme in metabolic pathway is dihydrofolate reductase, that is blocked by an anti-cancer drug methotrexate. Then T for trimethoprim, and there are 2 P's, proguanil, and one more P is pyrimethamine. Pyrimethamine is one more P, I will write again, pyrimethamine. Then the target is inhibiting protein synthesis. Recently in FMG they had asked this question, who inhibit protein synthesis? The drugs can bind to 30S ribosome, 50S ribosome. 30S, the tetracyclines and aminoglycosides. 50S, the chloramphenicol, then linezolid. Then we have the MCQ drugs. MCQ. What are these MCQ? Macrolide like azithromycin, erythromycin. C for clindamycin. and Q for a combination of quinapritin and dalfapritin. Now this is a revision, so I hope you have studied it once. So this will make it clear the drugs where they target cell wall, cell membrane, DNA, folic acid synthesis, dihydrofolate and protein synthesis. Just have a look into that. Okay, so if you are clear, then I will move to the next question. Now, drug of choice for typhoid fever, very common in India. The drug of choice for typhoid fever is ceftriaxone. Now, ceftriaxone is also drug of choice for certain conditions. One is typhoid fever, one STD called gonorrhea. It is a drug of choice for chancroid, and also it is the empirical drug of choice for meningitis. So this is about ceftriaxone for you. This is the important aspect among this. Cefoperazone, operazone, a cephalosporin. The main problem of this is it can cause disulfiram reaction. Disulfiram, and also it can increase the bleeding tendency. At least remember the name, cefoperazone. So that is about drug of choice for typhoid fever. Empirical choice of meningitis means Kaushik, it is for bacterial meningitis. Now, since you have asked cryptococcal, very good question. Recently they had asked in FMG, cryptococcal meningitis, what is the drug of choice? The drug of choice is liposomal amphotericin B. So please mark this, liposomal amphotericin B. Sometimes it can be given with flucytosine, with or without flucytosine. But if it is not given, just give liposomal amphotericin B. Very good, Nidhi, you remember the LAMB. LAMB means liposomal amphotericin B. Now, can you tell me one more condition where it is drug of choice? In fungal infection, mucormycosis, it is a drug of choice. Now, you tell me one more non-fungal infection where this is the drug of choice, which is very common in India. It is done by Leishmania. What is that? It's a drug of choice for Kala Azar. So remember the liposomal amphotericin B, also the LAMB. It is a drug of choice for three things: cryptococcal meningitis, mucormycosis and Kala Azar. Since we started here some fungus, I will also ask you one more thing. What is the drug of choice for invasive aspergillosis? Kala, very good. Invasive aspergillosis, the drug of choice is voriconazole. The drug of choice is voriconazole. So these are the highlighted things. At least if you have not studied anything, I have tried to cover most important points in this video. At least revise that and go. Now, ocular side effects are seen with which anti-TB drug? Now remember, eye problem is seen with ethambutol. Ethambutol can cause red-green blindness, decreases the visual acuity. So the answer is C. Now pyrazinamide starts with P, so it can cause pain. Where, sir? Joint pain. That is called arthralgia. Why joint pain, sir? Because it increases uric acid. Now rifampicin starts with R, so it can cause redness, red color. Where, sir? Everywhere. It can make the secretions orange red color. Saliva, sweat, tears, all of them. Even contact lens can get color. Isoniazid, remember the INH. Now I means it increases the psychosis. It can cause seizures. That means in high dose. N, neuropathy. So patient will come and tell you, I am developing pins and needle sensation. That is peripheral neuropathy. Now what is the treatment if the patient tells you like that? You should tell me. H, the drug is toxic to the liver. It is hepatotoxic. Tell me what you give for this pins and needle sensation. You know it. We have to give pyridoxine, that is 10 milligram every day. B6, very good. So these are very, very important things. Now since since TB is a very common problem, which anti-TB drug can cause hypothyroidism? Two important drugs are PAS, para-aminosalicylate, and a drug called ethionamide can do this. They can do that. Now moving on to the next question, which of the following inhibits mycobacterial ATP synthesis? A new drug by the name bedaquiline. Now what does isoniazid do? It inhibits mycolic acid synthesis. That means it inhibits cell wall. Rifampicin, again the name starts with R, it inhibits RNA polymerase. Sir, what is this RNA polymerase? It is called as DNA dependent RNA polymerase. Ethambutol not important. If you want, it inhibits arabinogalactone synthesis, which is required for cell wall synthesis. So bedaquiline is a recently approved drug for tuberculosis, but bedaquiline, one adverse effect, can you tell me? One I will tell you. It is toxic to the liver, hepatotoxic. But one, it can cause something in ECG. Can anybody tell me? Can anybody tell me the ECG? In ECG, it can cause QT prolongation. In one of the recent exams, they had asked this question. Which anti-TB drug can cause QT prolongation? Bedaquiline. And also they had asked which one stops ATP synthesis? Bedaquiline. Now in TB, the treatment wise, remember, if it is drug sensitive TB, we have the phases called intensive phase, continuous phase. In intensive, we use HRZD, we give it daily, and that is for 2 months. Continuous phase, we use only 3 drugs HRE daily, and that is for 4 months. So it is for adult, child, everyone. But they will ask you the definition, MDR, TB. You know MDR means multi-drug resistance, when there is resistance for H and R. Now pre-XDR TB, what is that? Same H and R resistance plus 1 fluoroquinolone. Then what is XDR TB? Same H and R, 1 fluoroquinolone plus bedaquiline or linezolide. B, either bedaquiline or L, linezolide. So this much information is enough for you. Now metronidazole is used in below condition, where H. pylori it is used, yes. Giardiasis it is used, trichomoniasis it is used. It is not used in enteric fever. Read the question carefully, except. But they will ask you metronidazole as a drug of choice for giardiasis. It is a drug of choice for trichomoniasis. How do you know trichomoniasis? The strawberry cervix. Giardiasis causes diarrhea. One more condition they will ask you, it has a drug of choice is in a condition called bacterial vaginosis. So guys, tell me, how do you know in the case that there is bacterial vaginosis? What is the clue you get to diagnose it as bacterial vaginosis? Anybody? The odor, and the presence of clue cells. That is a clue to tell it is bacterial vaginosis. That is metronidazole for you, and metronidazole and alcohol should never be combined. That will lead to disulfiram like reaction, tested plenty of times. 3 drug of choices: giardiasis, enteric fever and vaginosis, and it is also drug of choice for amoebiasis, both intestinal and extra-intestinal amoebiasis. Yes, Harry, you are right. Rani Mani, you are right. Then moving on to the drugs in HIV, mechanism of action of protease inhibitors. Now protease inhibitors, they don't allow the assembly of viral proteins. So the answer is B. The inhibitor of CCR5, they are called maraviroc. And the inhibitor of reverse transcriptase, there are 2 types, NRTI and NNRTI. Now NRTI, they are called nucleoside reverse transcriptase inhibitor. I can tell you the name: zidovudin, stavudin, didanosine, abacavir, tenofovir, lamivudin, emtricitabine. NNRTI, we have the delaviridine, efavirenz, nevirapine. GP41 inhibitor is called as enfuviritide. Now they can ask you one important thing: integrase inhibitors in HIV. These are ending with tegravir. Tegravir, for example, dolutegravir, like that. So that is about the drugs for HIV, the mechanisms. Coming on to the next one, oseltamivir. Now oseltamivir is a drug which is used in influenza. Influenza A and B. Remember, it can be used for treatment also, prophylaxis also. What is the mechanism? It's a neuraminidase inhibitor. So the answer is A. Now what drug inhibits RNA-dependent RNA polymerase? There are 2 drugs, remdesivir and ribavirin. So remdesivir, most of you remember, it was used for COVID-19. Ribavirin is used for treating hepatitis C infection. Now whenever you think of virus, they will ask you the drug of choice for herpes 1, herpes 2, varicella zoster virus. The drug of choice is acyclovir. Now what is the drug of choice for cytomegalovirus, CMV? Now you answer that. Cytomegalovirus, you have to get the GAN for that. The name is ganciclovir. Now if both are resistant, then the name of the drug which is given is foscarnet. Foscarnet. Yes, the next question. Yes, very good, most of you have answered. Nidiimatinib is used for CML, the drug of choice for CML. Tendinitis, tendon rupture and cartilage damage is caused by, obviously, ciprofloxacin. That is, fluoroquinolones can do that. Fluoroquinolones can also produce photosensitivity, and also they can cause QT prolongation. Then doxycycline belongs to tetracycline group of drug. Amikacin belongs to aminoglycoside. 3 important problem with them is they are ototoxic, they are toxic to the kidney, and they can cause neuromuscular blockade. Erythromycin, main problem, adverse effect is it can cause diarrhea, and I told you it's an enzyme inhibitor. So this important aspect you have to remember. Another thing I want to tell you, suppose there is a pregnant woman, which antibacterials are safe? PCM are safe. What are PCM? Penicillin is safe in pregnant women, cephalosporin is safe, macrolide are safe. Which are teratogenic in pregnant women? Remember the name fat. What are fat drugs? F for fluoroquinolones because they damage the cartilage and tendon. A amylglycoside, aminoglycoside, they damage the ear, then kidney. Tetracycline have 4 toxicity: liver toxicity, they have kidney toxicity, and they discolor the teeth, they cause the bone damage. So these should never be given in pregnant women. Nidhi, PCM, paracetamol, yeah, we call them at like that only. This is a PCM, very good. Paracetamol is also safe in pregnancy, but these are antibiotics, what I told, don't worry. Yes. Yes. A patient visited an endemic area of malaria and was given prophylaxis for malaria. How many weeks he need to take the drug during travel? So this is the last question for you guys. Tell me, malaria prophylaxis, and malaria is a favorite for FMG exams. So please answer this. Yes, malaria prophylaxis. How many days after coming you have to take the prophylaxis? 28 days during travel, entire duration of travel, and later 4 weeks after travel, 14 days during travel, 7 days during travel. What is the best one? The best one is he has to take the tablet entire duration. Even after he comes back, he has to take it for another 4 weeks. So let me tell you the prophylaxis of malaria. Listen carefully. Prophylaxis. Two drugs are used. Doxycycline. If the week journey is less than 6 weeks. So 1 to 2 days before journey, we have to give doxycycline, start it, and this is the end of the journey. So when you are in the journey, daily you have to take doxycycline. Your journey ended. Even after the journey has ended, you have to take it for 28 days. It is taken 28 days after the journey also. Second, mefloquine. Now mefloquine is longer acting. If the travel is more than 6 weeks, it is started 1 week before journey, 1 week before, and it is taken, it is the start and end, it is taken weekly 1 tablet. And after coming back, it has to be taken for another 4 weeks. So this is the malaria prophylaxis. They have asked it plenty of times, guys. Okay, so I want to add some more points here. Malaria, because it's a favorite for the examiner, I just want to add something here. Now malaria, it can be vivax malaria or falciform malaria. Vivax malaria, I can give chloroquine and primaquine. Chloroquine for 3 days and primaquine given for 14 days. The reason why I give 14 days, primaquine is for radical cure. That is for vivax. Falciform malaria, chloroquine will not work. So we use a combination therapy called artemisinin combination therapy. It depends which part of the country you are treating, northeastern part or rest of India. Northeast, what we use is artemether plus lumefantrine. Remember the MeMe. Rest of India, remember artesunate, remember the sunate, and sulfadoxine, another SU with pyrimethamine. With, I think I will push it this side. This is for the rest of India. And for both the regimen, you can give a single dose of primaquine. Why? To kill gametes. It kills the gametes of all the species. And primaquine should never be given in pregnant, not given in G6PD deficient patients. The next thing they can ask you in the exam is, if she is a pregnant woman, then what is your choice? If pregnant is having, I will tell Sai Krishna, pregnant woman, if it is Vivax, I can give chloroquine. If it is falciparum, then what to do? Now, I give chloroquine, sir. Can I give primaquine in pregnant women? No, primaquine is contraindicated in pregnant women, so I don't give. I give just chloroquine. Now, in falciparum malaria, I have to give artemisinin combination therapy. Now, it changes in first and second trimester. In first trimester, the best one to give is quinine. If you get clindamycin, you can add that. If clindamycin is not there, you can only give quinine, no problem. In second and third trimester, you can give the AT regimen, that is artemisinin combination therapy. Yes, quinine for pregnant women, that is for falciparum malaria. Vivax you can give chloroquine. Then a complicated malaria called cerebral malaria. If there is cerebral malaria, it's a complication, so I have to give intravenous artesunate. So any patient, whether she is pregnant or non-pregnant, cerebral malaria, the drug of choice is IV artesunate. So I have covered all the treatment aspect of malaria here, and every year the question keeps on coming. So don't leave malaria. Okay. So that is about today's session. This is your Dr. Bharat Kumar VD, Medway online faculty, and this is my Telegram and Instagram. You can follow here, and any queries, anything you want, you can ask me directly from this. And if you have liked the session, please put a thumbs up, press the like button and subscribe to our channel. And I want to give you my best wishes for your exams, whatever exams you are writing, my best wishes. Most important thing near to the exam is the confidence. So tell your brain that you have studied really well, because confidence matters at this point of time. Don't go with the new informations. Whatever you have in your hand, that much is enough. Revise it thoroughly and success will be yours. Okay, so that's it for today, and I've tried to cover most important things here. So please put your messages. Any doubts you have, I'm ready to do that. Yes, Sai Krishna, you can log into the Telegram or Instagram and ask me this. We'll try to share you directly. Yes, Yogesh, you can contact from here. Okay, you'll get my group, you'll get my Instagram. Yes, guys, so this is the point. So any doubt you want, please tell me. Yes, Hari, I will share with you. Because the list is with another iPad, that's why I'm not having in this, that's why. Okay, so any queries, any doubt in pharma, please ask me. And tell me how did the session help you. Please put a message here. Okay, so if there are now queries, my best wishes for you for the exams, and I am waiting for your messages, and come up with flying colors. Thank you all, take care. नहीं खत्म हो गया 2 hours हो गए ना